Let's get started. I am excited to introduce you to today's expert. We have Dr. Gwen Worm with us. Welcome.
Hi, how are you doing today? Good morning.
I
Good
am doing well.
afternoon.
I do have my coffee. Feeling a little stuffy, so I brought my coffee. So forgive me if I sip coffee throughout, but I think that's going to help us get through the day. But I'm excited, audience, to tell you about Dr. Gwen Worm. She is Assistant Director of Pediatrics at the University of Miami Miller School of Medicine. She is also a pediatrician with a commitment to integrating traditional medicine treatment with holistic approaches to child and adult health. She is board certified in general pediatrics, developmental behavior pediatrics, and integrative medicine. And she has dedicated her career to providing that comprehensive care that really addresses the whole person. Man, you're such an expert, and I'm so excited that we get to pick your brain today. She has also received her medical degree from Boston University and her Master of Public Health from Harvard University. With extensive experience in academic medicine, community pediatrics, and research, she is passionate about fostering healthy lifestyles and promoting nutrition focused care for all ages. You are in the right place today. We are so lucky to get the time with you. Thank you so much for joining us.
Thank you. Good morning. Good afternoon. Yeah, I'm excited to answer these questions and that so many people are interested in this topic. Keeping kids healthy is really something that I feel very passionate about. And please remember that all parents are the expert on their child. Okay. Nobody is the expert other than you.
I love that. Thank you for saying that and for leading with that. Because I think sometimes I know as a parent, I can feel like I don't know what I'm doing. But you know what I do know is I know my child, and no one knows my child like I know my child. And so, even in advocating for our healthcare, keep all that information in mind, mamas and daddies and caregivers, that we know our children. So, thank you for starting with that. So, we're talking today about integrating, traditional medicine and the holistic approach. But talk to us, explain what is integrated or natural medicine. Is that the same? I hear the term holistic medicine.
Sure.
Are those terms the same or interchangeable?
So I think the one thing that I'd like to say is any good pediatrician, granted I'm board certified in it, but any good pediatrician is an integrative pediatrician. And what that means is that we go to medical school, we learn a lot of stuff, but we also know what we don't know. And we work with what we call allopathic medicine or traditional antibiotics care when we need them. We track development and all those wonderful things we learn. But there's also, a tradition of natural medications that are appropriate sometimes when kids don't need antibiotics. I mean, we've gone through, different ups and downs in medicine, and we've learned a lot over the years. And one thing that we've learned is that sometimes natural treatment is best. Sometimes letting the immune system do its job is best.
Mhm.
But that said, we don't want to deny using the medications that have been life saving or the immunizations that have been life saving that we've learned in the last decades of care. So, integrative medicine is really about listening to the story of the patient, finding out about what's going on, where are the problems arising from, and where can we best intervene. So it's really about being a good listener. It's about spending time with patients and about honoring everybody's tradition and working with people to keep everybody healthy.
I love that. I just the word listening. I think that's something I don't think of as so necessary in a healthcare provider until you're in a situation where you realize they didn't or don't. You know what I mean? When you kind of get in a situation like, wait, you're not even listening to me to tell you the whole story. So I think I'm so glad you said that. I think that's very important as we're selecting, even healthcare providers or taking our children to these pediatric appointments, like noticing, like, is this doctor listening to, like you said, I'm the expert in my child to share all these things. So thank you for saying that. Talk to us about how parents can effectively prevent just the common childhood illnesses through a
Sure.
combination of maybe natural and conventional.
So the first thing that's the most critically important is for kids to get immunizations.
Mhm.
What we know is that immunizations have really drastically changed what we die of in this country. If we think about it worldwide, over 100,000 kids last year in this world died from measles. We are
Wow.
very spoiled in this country in that we don't see these diseases because we do have a public health system and we do have a vaccination system and people have access to care and they're able to be immunized. The immunizations have been studied and they are safe and effective. So the cornerstone of pediatrics is really getting the immunizations that are the, required and many of the recommendation, immunizations. Your pediatricians can talk to you about any of them. Um, one of the things that's really, really hard right now is it's very difficult to be a parent. I
Mm,
can create a website. I've got all my education and training and all of that. But you know what? My next door neighbor who may not, have any of that and may not even have kids can set up a
right.
pediatric website and it can look
Mm,
just the same.
that's right.
And so it's very hard to know what is the best information. And so I really feel for parents because it's very difficult to sort through what's on the internet. I think anybody in any field knows, whether it's an accountant, whether it's a lawyer, you can get a lot of bad legal information on the internet.
Yeah.
You can get a lot of bad nutrition information on the internet, and it's really hard to know what is right.
Right.
Um,
Yeah. You're
so
right.
I think, that's very, very hard. But one thing that we do know is that immunizations save lives.
Mm,
Um, and I think that's very important. And I can't say that enough to people.
yeah.
So I
Thank
would
you.
say that's first and foremost is good. The other thing we talk about is, feeding your child. Breastfeeding is best, but
Mhm.
that doesn't mean that formula is awful. I mean, there are many parents who, for different reasons, can't breastfeed, be it, some biologic issue or it's because of, some resource issues or something like that. But so just because breastfeeding is best doesn't mean that kids won't thrive on formula. And so that's something to keep in mind. The important thing is that kids get fed and that you work with your pediatrician. Now, the most important thing about an illness is, and please interrupt me if I'm going on for too long.
No, this is great. Yeah.
Um,
Thank you.
Everybody's going to get sick. Okay.
Wow.
So when somebody comes to me and says, my kid gets sick every 4 to 6 weeks when they're in daycare, what's wrong with my child? My first question isn't how often are they getting sick, but how long does it take them to get better?
Hmm.
What's
Okay.
going on? Because we're exposed to tens of thousands of microbes. And in fact, we have a trillion microbes living in our own body, in our own
Wow. Yeah.
gut.
Wow.
So microbes we share the planet with.
Yeah.
So we need to figure out, how are we good hosts? How do we cure ourselves with what we set up every day? So the most important thing is that we're feeding our kids healthy foods.
Yeah.
And unfortunately, in this country, 67% of kids have a diet that is predominantly
Mm,
processed foods.
mm.
Are our kids getting sleep, which maybe isn't a problem for a 2-year-old, but it's certainly a problem for our 16 and 17-year-olds?
Yeah. Wow. Yeah.
Um, and then, are our kids being attached to screens all day, which we
Right.
know can have effects on the brain. So we
Yeah.
want to look at, what are we walking into that illness with? Now, of course,
Right.
genetics, trump many, many things. And so we have to think about our genetics as part of something that we need to discuss with our, pediatrician with, to know what's going on.
Yeah, no, that's helpful. So on that note, I hadn't thought of it that way of like, the question is how often should we expect our children to get sick? But I like how you said, well, how long are they sick and how long does it take them to recover? But I mean, how often, like you said, there's germs all around us. So what is kind of like, is there a norm of like we should expect the kids to kind of,
Sure.
every spring to have a cold or what?
So it depends. So for example, your first baby, if you're lucky enough to, live in a place where there's not many people sharing your apartment or whatever, your first baby, if they're home for the first 6 or 9 months and things like that, may not get sick very often.
Right.
Okay. Um, but that all changes. They're like, oh, my first baby really didn't get sick, but my second one, oh my God,
What
what's wrong with
happened?
this kid? Well, what's wrong with this kid is the first kid is bringing home all those germs from
All the
daycare.
germs. Yeah.
So, so the thing is, every kid that your 2-year-old play with, your 3-month-old is playing with. And
Mm,
that's how that happens. You cannot separate siblings in a home, nor would you ever want to. I
right.
mean, you want them to have that healthy interaction. And in fact, during, the studies go back to like during the time of polios, the kids that lived in farm who were playing in dirt, they tended to do better than the city
Mm,
kids. So
yeah.
don't be
Interesting.
afraid of germs.
Okay, here's a question on that. This is a personal question. I'll be honest. This is me and my philosophy of I have a lot of children. I have five. And so if we get the stomach bug or something, I'm like surrendered to the fact of trying to keep them separate. I'm like, y'all just let's just hunker down and knock this thing out. Is
Yeah.
there any, I don't know. I mean, that's maybe a silly question, but when you have multiple kids and one is sick and of course we're washing our hands and we're doing these things,
Sure.
but is it best to like let's hunker down and ride this thing out together or
I think if somebody's having a fever, keeping them separate, keeping them away, mainly for them, so
yeah,
that they don't feel bad. So, obviously, I think it's a little bit difficult if you have a 1 month old and then you have a 4 year old with
right,
104. That kid, I would want to,
for
probably
sure.
separate a little bit. But no, I think you're absolutely right. I mean, you know, don't go overboard where you make them all
Right.
drink from the same cup. I
Oh
mean,
no. You can just make yourself crazy trying to keep them
no,
separate,
no,
you know?
and don't do that. The only thing I would recommend is obviously if you have a child who has some kind of immune compromise, that's a
Right.
little bit of a different thing. And please discuss that with your doctor. If there's elderly grandparents around, those are people that maybe you'd say, you know what, we'll see you next week.
Yeah,
So
right.
you want to, think about if somebody has a specific risk. So for example, if you have a child who has severe asthma, that might be something where you go to your pediatrician and say, listen, what do you think I should do in advance? They may say, well, start, some of your, medications for asthma in advance. So I think there are some specific things, but for your normal, healthy children, do the best you can. Avoid having them cough on each other. That
Of
never
course.
feels good anyway. But yeah, you're absolutely right.
Okay, you talked a little bit about, the 67% of children who are eating processed food. Talk to us about the role of nutrition in building strong immune systems and preventing illness in children, because I think we underestimate how important that is.
Okay, I would start off by saying and not exaggerating, nutrition is everything.
Mhm.
Okay. The what we put in, so like I said, we have 100 trillion bacteria living in our body at any given time. There are more, people are shocked by this, but we have is more serotonin receptors, serotonin, the thing that we talk about for SSRIs, for depression and anxiety, all that, in our gut than in our brain. Okay.
Wow.
When people talk about the brain and the gut communicating, that's true. When people say they're
Wow.
sick to their stomach when they're anxious, they are,
Wow.
because of all of that serotonin surges and things like that. The bacteria in our body, we can either have healthy ones or unhealthy ones. Okay.
Okay.
When we eat the healthy foods that have, you've heard the term prebiotics. Prebiotics is essentially healthy, natural foods that have fiber and nutrients and phytonutrients, phyto meaning nutrients, from vegetables. When we're eating those things, we actually are selecting for healthy bacteria that need that to live. An interesting fact is that breast milk actually has a special type of polysaccharide, that the baby doesn't digest, specifically to feed a certain type of bacteria in the gut of the baby, of the
Wow,
newborn.
it's
So
amazing.
we live with our planet. Okay. So the more that we can eat the natural foods, the better. Now, sometimes what happens is when we eat these processed foods, they're high sugar foods and they select for the unhealthy bacteria. They don't have the healthy fibers and the healthy phytonutrients that the healthy bacteria need to live. So what
Mm.
happens is those are and in some cases, for example, this has been linked with cancer later on in life.
Wow.
It's been linked with things like, not a surprise, gastrointestinal disorders. It's been
Yeah.
linked with autoimmune disease like rheumatoid disorders.
Hmm.
It's also been linked with behavioral problems,
I believe
with
it. Yeah.
kids, the unhealthy eating and not getting the nutrients that we need. But it's not just the nutrients, it's this healthy bacteria and the microbiome. So it's on many different levels. So it's not just I give a vitamin, which can be sometimes helpful, but it's really all of what we call those prebiotic foods, those fibers and undigestible polysaccharides that really can help nourish the gut and what's going on in there. Um,
Well, I feel
the,
like we could do a whole episode on gut health. So
yeah,
my
and
notes,
it's a huge topic. I mean, it's
Yeah.
a big topic, but keep in mind it's not complicated. Okay.
Yeah.
So people think that nutrition is complicated. Really not. Okay. If you think back, talk to the grandmother or, or great grandmother, whatever. If it doesn't look like food, it's not food.
Yeah.
Okay. If it comes in a bag or package, although I have had some kids say we buy apples in a bag. I'm like, okay, that's good.
Yeah.
The But if it comes in a bag and it's got a lot of ingredients on it,
Yeah.
you don't want it. Okay.
Yeah.
Now, I'm not saying never, if we're
Right.
aiming for 75%, that's great. But we know, for example, juices, not
Yeah.
healthy. I don't care how much you pay for the juice at the juice store.
Yeah.
Most of the juices are just concentrated sugar. If you
Mm,
think about it, it takes 3 or 4 apples to get that cup of apple juice, right?
that's right.
That's a lot of sugar. If you sat down, most people would not
Wouldn't
be eating
eat 5 apples.
four apples.
Yeah.
Correct.
Yeah, that's a good
And
point.
and we're losing all of the wonderful things that are in the skin of the apple, the fiber in the apple. There are things in the apple that make us full, which is why we don't want to eat 5 of them, right?
Gotcha.
So,
Yeah.
think about making a plate. We think about a plate being half fruit and vegetables, and then maybe a little bit of grain, a little bit of protein. And
Okay.
that's fine. That's
Yeah.
that's all you need. It's not that complicated. Um, so don't overthink things.
That's
Um,
great. Yeah, so it's super important in building that strong immune system and how the gut and the brain is all related. I think that's fascinating. And I think I would like to dig more into that in a future episode. Let's talk about, we're talking about traditional, conventional. What should parents consider, or rather, when should they consider over-the-counter medicines for their children? And what are some natural alternatives?
sure. So the first thing is that natural products are never a substitute for when you need a traditional medicine. Okay, so I think that's something to keep in mind. If you go to your doctor and your doctor says, your kid has 104 fever and is having pain in their ear, and the doctor may say, listen, here's an antibiotic, want you wait, I'll often say, want you, see if Motrin can, calm the fever down and get him okay. But you know what? If it's not working, give that antibiotic. Antibiotics are life-saving. So it's not that we substitute, but there are many times when antibiotics are not appropriate. Okay. And when
Okay.
they're not appropriate, that's when the other alternatives come in. So you've done all your work, you're feeding your kid healthy, you're doing everything, and living on this planet, they get sick.
Yep.
That's good. Okay. That just lets me know they're out to play. They're being interactive with other kids. I say, yes, I'm
Good.
glad
Yeah.
that you're getting sick. Not that I want anybody to suffer, but it means you're interacting with the environment. So then we talk about what is natural. So the over-the-counter traditional medications that we talk about, um, they really don't work. Okay, so and the Academy of Pediatrics does not recommend using any of those like cold medicines, diamond, for some allergies and things like that, we do recommend those things. But in general, that whole swath of stuff in CVS and Walgreens, you don't need. And we
Mm,
don't recommend it, certainly in the young kids. Um, in general, for kids with colds, saline nose drops work really well to help with the stuffiness. There's a product called the Nose Frida, which is
yeah.
one that involves suctioning. Great, wonderful for kids. There are some electric versions of it that some people like. Excellent, because what we're doing is we're trying to make kids comfortable. That works really well. Steaming up the bathroom, really good for helping kids, get like that gunk out,
Right.
when they're having some difficulty. If a child is over the age of 1, okay, so they have to be over the age of 1 because we worry about things called botulism
Hmm.
toxin. Honey is spectacular. Honey has some really good research. So honey used to be one of the best medicines that used to use and distilled by Native Americans and things like that, that really has natural anti-inflammatories in it.
Mm,
So I like to give kids honey when they're over the age of 1,
yep.
just a small amount. I like to keep it thick and I like to keep it on the throat. So I don't want to dissolve it. If you want to put honey in tea, that's great. But
Yeah.
for a medical reason, you want to kind of have it on a spoon, maybe mix with a little bit of warm water, and letting that stay on the throat for the natural anti-inflammatory. So that can be really helpful. There are some small studies that support elderberry syrup. so that you see in the store. A teaspoon twice a day when they're sick. There have been some small studies that have been supportive for flu, not, and those are not going to hurt kids. So when we think about natural medicines, we think about things that, yeah, I generally use one. I mean, I'm not saying, I'm seeing a chat
You
question
have a
about,
question about age 2 for honey or one.
yeah,
Yeah.
generally
I've
I'm
heard one.
recommending
Yeah.
one. Yeah. But talk to your pediatrician, maybe they have a specific reason. But in general, uh, so the elderberry in natural medicine, what we think about is something safe and can it cause harm? So, what I will look at, there'll be, unfortunately, a lot of natural treatments. Honey is one where that's not the case because there has been some good studies in it. We don't have great proof, but we do know that many of these things have been used traditionally and that they're safe. So, that's kind of thing. So if somebody wants to do something that I think is dangerous and doesn't have proof, I'm like, oh, we're not doing that. But if
Right.
something has a history of safety, if somebody wants to give it a trial, say, well, you know what, why don't you try it for a few days? And if you think that it's helping, that's great. There is some small data, not great data, but small data on probiotics with respiratory infections, something that you can try. And there are certain brands that are better than others. I actually do like using consumerlabs.com. They will look at the different products that are out there, the different natural products. There's actually a natural medicine database, because it is very hard. It's a bit of a no man's land when you go on Amazon and there's like 50,000 of
You
just
could
about
find
any.
anything you want to find out there, but that doesn't mean it's the best thing for you. Yeah.
Right. So Consumer Labs is actually very good. I think it's like $50 a year to join it, and they'll give you information about a lot of kind of supplements and products that are out there. And I find them to be a very reliable source of information, but always talk to your doctor
Yeah. Great.
about things.
You mentioned that, maybe the elderberry, but are there other effective natural products that you would suggest for treating colds and flu? I love the saline. You said the saline, but
Yeah.
specifically cold and flu?
Generally not. I mean, unfortunately, the best thing is that tincture of thyme. I love, kids getting massages and things like that, anything that kind of calms them down. Certainly, ibuprofen and acetaminophen are good because they will make kids feel better. They'll bring their fever down. Um, but a lot of the stuff that's sold, sadly, there's really no support for it. I mean,
Yeah.
in terms of people looking for immune boosters and things like that for their kids, it's really about healthy eating,
Eat
getting
an
a good night's
orange.
sleep,
Yeah.
you know, drinking water. There's no immune booster for kids. People will sell you stuff and people will
Yeah.
spend a lot of money on stuff. But really other than really making a good home environment, that's really what's going to help you the most.
That's good. Yeah, thank you for that. I think it's so easy in the drugstore to stand there and you see there's 15 brands that say cold and flu, cold and flu, cold and flu, but it's like you can kind of put whatever you want on a box. So it's a good reminder that, in
Yeah,
market.
it's sad because I know parents want it so much and they spend so
Yeah.
much money on things, but it's really giving a lot of love, is what's, what makes a big difference.
Yeah, that's great. What about how can parents use natural remedies to address like common childhood rashes or allergies or digestive issues?
Sure. So in terms of, we can take those one at a time. So
Yeah.
probiotics can be very helpful for some digestive issues. So clearly, the first step is having a good healthy diet.
Yeah.
That's your best GI thing. And obviously, if your child is having any problem with weight gain or diarrhea or something like that, you need to talk to your pediatrician about that because there are some infections and some other things that might be a problem for that particular child. But in general, a good variety of healthy food is your best treatment for any kind of gut problem. Okay, and staying away from the added sugar and the processed foods.
Yeah.
That's the number one thing that I would suggest. In terms of allergies, there's a lot of different things about allergies. One thing is trying to obviously not have carpets in a room. Making sure there's not too many pillows, not too many stuffed animals or anything like that. Believe it or not, a stuffed animal can be 50% of its weight in dust, the way that they collect
Oh,
dust. you can't really clean them very well. So, if there's one thing that they want to have in their bed, great, all for it.
I'm
Um,
gonna throw them all away after this.
but
My
you
daughter's gonna
want
be,
to
where'd they all go? Yeah.
exactly let them
That's
choose
right.
one at a time.
That's right.
Pets in the room,
Hmm.
obviously I wouldn't take these things away unless there's a problem. You don't want to dust. What you want to do is wipe things down with a wet cloth, because when we dust, we do that. Sometimes if we have the ceiling fans, they're more spewing dust than anything else.
Yeah.
If you're like me, I always blame my husband for not changing the air conditioning filter, which, seems to never get changed
That's
until it
right.
like backs up.
Yeah.
So try and change them. Try and use, one thing we learned during COVID is really changing those filters and using, the highest HEPA filter that it can take in the air conditioning unit is great.
That's great.
I'm a major fan of air purifiers in the room. We have mold and dust and mildew everywhere. So having an air purifier in the room that has a HEPA filter can be very helpful for a kid that has allergies. Kids that have allergies, what I like to do is have them use, if they're old enough to do saline rinsing,
Hmm.
they can use a saline rinse bottle. But if not, just using the saline nose drops at night, having a shower, doing the saline nose drops. I like using the saline nose drops in the shower because they're already
Right.
moist, and then that helps. Um, that can be really helpful, doing the saline nose drops at night. If a kid is having a problem with allergies and stuff, try not to feed them too much before going to bed, because they'll have you know, we like to think of it as one thing causes a problem, but it's often many things. So if you
Yeah.
have a cold and you have a little bit of allergies and then you ate too much before you went to bed, you might have a little bit of reflux, with your allergy and all of that. So the more that we can work on little things instead of trying to blast one thing,
That's right.
the better off we'll be.
That's great. That's great. Thank you, Dr. Worm. I have a few questions directly from our audience. So, a few different topics here, but excuse me. One said, "Is it bad if I'm giving formula to my 20-month-old daughter to help her sleep?"
I think that's a bigger conversation, because, one thing is that we really don't recommend bottles. I assume with a formula, they're using a bottle. We really don't recommend bottles much after, 15 months. So there may be other kinds of things. Formula is really not necessary. I would just go with a natural milk or natural, something, or water. I don't really like a lot of milk before bed. I think that can sit on the stomach and you can get some reflux associated with it. They don't need that. So a 20-month-old, talk to your pediatrician, but generally 20-month-olds don't need the nutrition of that bottle.
Yep.
So, so I would really work to come up with a better nighttime routine. If you feel you need to give something, maybe an ounce in a cup. But the one thing that you also want to be aware of is that there's natural sugars that occur in any kind of milk product, be it a formula, be it a milk.
Hmm.
And you need to brush your teeth after that.
Yeah, I know. We with our dentist friends, they're like, "That's the worst thing you can do for the teeth."
Yeah.
So
So
be
try and
fair.
work on a nighttime routine. So often what happens is, we don't evolve our routine. And there are, 20-month-olds, they like to look at books, they can like to sing songs, so there are other things that you can do that you can incorporate a new nighttime routine.
That's great. That's great. Thank you for that. All right, back to the honey question. This one says, how much should you give to a 20-month-old? Like, are we talking like a teaspoon when you're giving it to coat the throat?
Just a small amount is fine.
Yeah.
Honey's not going to hurt them.
Yeah. That's great. All right. Is it true that when a child has a fever, you should bathe them in very cold water?
No, absolutely not. Thank you for asking. No, we don't. So the body is a really interesting thing. So essentially what we do is we have our inner, we don't want to change what happens in the brain too fast. We don't want a
Yeah.
difference between the brain and the body. The brain has this
Right.
wonderful protection, um, called the blood-brain barrier, which kind of protects it from, these shocking changes. So we want to use a lukewarm, bath kind of thing, or a lukewarm towel on the head. We definitely don't want that alcohol. We don't want the cold. We don't want to shock the body into a change.
Yeah.
Anything that shocks the body into a change is not a good thing. Now, obviously, that's a little bit different when we have the hypothermic people and stuff like that. And that's an ER situation. That's a little
Yeah.
bit different if we have to do quick cooling because of a baby, somebody being super high, but that's not in this situation.
Yeah, that's great. Thank you. Okay, here's another one back to the medicines that are natural and that kind of thing. So this listener says, when my 8-year-old daughter has a cough, I give her zarbees. I've heard of this one press product. And it says this medicine is marketed as free and natural. Is it good?
Yeah, I can't comment on a particular medication.
Yeah.
What I can tell you is that the only thing that has any proof is honey.
Yeah.
So,
Great. Easy.
yeah,
Switch to
so
honey.
that way, it doesn't mean that that may not help your daughter. So what I tell people is this, is that we don't have evidence for everything. And it goes back to, what can we recommend or not? And I think that, we live in a society where there's many, many choices.
Yeah.
So there's no one answer. If you go on the internet, it'll say this medication, my kid is off, lost their cold and got into Harvard at age 10. Now, they can say whatever they want.
Right.
So what I would recommend is if you're 11-year-old, keep in mind, so there is something called the placebo effect. Now,
Yeah.
that doesn't mean that something isn't helping.
Right.
There's actually some great research about placebo effect that it turns on certain, you know, things in our brain, certain enzymes in our brain that
Yeah.
actually help us heal.
Wow.
So the
Yeah.
placebo effect is amazingly, amazingly powerful.
Yeah.
So, and a lot of the medications we have for many different diseases work by placebo effect to the degree that when we talk about doing case control studies, we do that to account for that placebo effect.
Yeah.
So when I say placebo effect, I honor that effect. I mean, that effect is
Yeah.
super important. And if you giving your child this medicine that's natural and they feel really good about it and they feel loved and that's working for them, that's great. If it's not doing any for them, don't give it anymore.
Yeah.
So
Yeah.
if something that's like this is good. Now, I don't say the same thing for antibiotics because, if we're actually treating something that needs that treatment, I want you to follow whatever your doctor says. You can certainly ask your doctor lots of questions. I
Right.
encourage questioning. And the one thing I would say is anytime you give an antibiotic, except in very unusual circumstances, please give a probiotic because the probiotic does help. There's good research to show that the probiotics will help prevent the diarrhea that comes when we give antibiotics. Although the amoxicillins and things like that we give for kids actually generally don't cause those kind of problems. But I always do recommend a probiotic.
It's great.
Um, but yeah, if something is working, use it. And if something isn't, so there's many things that I might try with somebody for other kinds of things where I'll say, listen, let's give this a 3-month trial. And if it works, great. And if it doesn't, that's okay. Nothing lost because everybody's body is different.
Yeah, that's right.
Everybody's genetics is different.
That's great. Our audience is getting really involved now, so I've got lots of questions for you. Okay, someone asked any recommendation on how to do a gut cleanse for a toddler or a school age child.
Okay, I'm not sure what they mean by that, but what
Right.
I would say is that, if they're suffering from constipation or something like that, they need to work with their doctor on that.
Hmm.
But the whole concept of gut cleansing is our body is incredible in
Yeah.
terms of its self-healing.
Well, yeah,
Um, don't worry about getting out the bad stuff. Worry about giving the good stuff.
that's
So
good.
if like I said, any big changes to the body, anything dramatic, unless we're having a serious illness that we need to deal with, just go back to the basics.
Yeah.
Go to a healthy diet. You know,
Trade the goldfish for the apple. Yeah.
right. So one thing I tell people is that if you feel something's going on with your kid's gut, you don't need, like I said, I do integrative medicine, but there's a lot of providers out there who maybe do some things that don't have a lot of evidence to support it. So doing stool studies and doing all of that. I'm more interested in what am I going to do to heal?
To be
Okay.
proactive. Yeah, that's great.
And so giving a healthy, natural diet is a great healing. If you want to throw some probiotics in and that makes you feel that that's something, we don't have great evidence on that, but if you want to do that, that's where I fall into that, you know, low risk and see how it goes.
Yeah, that's great.
Okay. So that's what I want to think about is don't get all caught up and, you can go on the internet and people say, do this, do that, buy this product, buy that product. Just go to a healthy diet.
Yeah.
And within a few weeks, that diet heals.
Yeah. That's great. Okay, I want to shift to when is it appropriate to seek medical attention for a child's illness? And on that note, this is from our audience. This was, I thought, a great word here. I think it's from someone from Jackson, but talk to us when it's necessary to take children to the emergency room versus primary care for like a cold. Because they said we see people come in, they're bringing their kids to the ER and they have a cold, but then they're exposed to all these other things in the ED. So how can we, keeping our kids hydrated, but what do we do? Do we go to primary care? Do we go to urgent care? Do we go to ER? That kind of thing.
Okay. So the first thing is if you're really worried, always seek care. I
Yeah,
mean, that's the first thing, because like I said, you're the expert on your child and you could
that's
go
right.
through a checklist of all these different things that say your kid is okay, but in your heart, your kid is not.
Yeah,
You are the right person to know
yeah,
that. Okay. So everybody should seek care when they feel they really need to do that. Okay. So I never want to discourage anybody from seeking care. One of the challenges we have with primary care is there's a shortage of pediatricians, a shortage of doctors. It sometimes can be near impossible to get into your primary care's office. Um, Telehealth can be a good option sometimes. But if you can't get in, sometimes people are going to urgent care and to ERs because they just can't get into their primary care office. So and sometimes, unfortunately, daycares are requiring them to do that in order to get back into a daycare or
right.
into a school or something like that. So I do encourage you, if you have a physician who uses telehealth, see if you can use that, but your kid has to be there when you do the telehealth.
Yeah,
So, but telehealth seems to be a very good option. And now there are some services online
yeah,
that can work with you. So so telehealth is good, and many offices now do have time set aside for telehealth appointments, and most offices can fit in telehealth visits pretty easily. um so in terms of so any baby under 2 months with a fever greater than
yeah,
100.4, they need to go to the ER. Okay, that's a nonstop. Okay, we don't have many signs or symptoms of what is going on in those age groups. We have to worry about serious infectious disease. Those
yeah,
kids need to go. Okay.
yeah.
I don't care if there's 3 other kids at home that are sick. Once that kid pops a temperature, they need an
So
evaluation.
2 months or younger, 100.4, right?
Okay.
Yeah,
Any baby, so under 2 months, any baby who's stopped feeding, who's
yeah,
having vomiting, who's having a lot of diarrhea, the trigger on when to bring the 2-month-old is really super sensitive.
yeah,
As soon as you think there's an issue, do it. Okay. Once they get a little bit older, in general, I would say that a kid that can smile at you is probably going to be okay. Not always, but probably be okay. So if you can get your kid to smile, you're probably good. Okay.
great.
You may want to, if a kid has a fever, you may want to try giving them some acetaminophen or ibuprofen and seeing how they do. Wait 30 minutes, and if they seem better, probably what's going on is some kind of viral process. Okay. As long as they can take some fluids, they don't need to eat, but as long as they can take fluids, kids should be okay, for a
Great.
few days. Fevers can last, 3, 4, 5 days. After 5 days, you do want to check in and see what's going on.
Yeah,
If they've been running a high fever for 5 days, any change in mental status, that's something that we would want to get evaluated right away. Um, Try the saline nose drops. Try the humidified air. Try, if they're over the age of 1, try the honey. And see what you can do at home. But if you feel uncomfortable, then that's a reason to go be checked out.
yeah. Great. Thank you for that. You mentioned about going to daycare, school. When is it safe to send a child back to school or daycare after an illness? And what precautions should you take to not spread those germs?
But that's a spectacular question of which, unfortunately, there's not a great answer.
Yeah.
So, in general, I would say follow your own gut, which is if you wouldn't want that your kid sitting next to you wouldn't want a kid that
Think
looks like
about
you're
it the other
sitting
way.
next to
That's
you,
good.
don't send the kid.
That's right.
Certain daycares are going to be more sensitive than others about what they'll accept. So a kid who has conjunctivitis, who has a little bit of a runny eye, most of those are viruses. If
Yeah.
they're very, very goopy, they will need a medication. But,
Yeah.
could they go to daycare? Probably, because they're no different than a cold, but most daycares will not accept them.
Right.
So you really need to look at what the daycare rules are. If your kid is just draining mucus all day long, keep him home. You don't want him like running his nose over, every
Yeah.
little toy in the daycare. If they're coughing all over the place. So just use your own common sense. Certainly, one rule we use is 24 hours without fever reducer, without fever, and using fever of 100 as a guide for that.
That's great. What about any like gastro things? Throw up or blow up kind of deals?
Yeah, you don't want them throwing up on their teacher.
No,
The
yeah.
probably doesn't help for grade point average.
Yeah.
But if they're throwing up and they're uncomfortable, keep them home. You know, the best thing to do is to really build your network of family, friends, people who can jump in. So when, so that you have a support group that can help you if your kid is sick. One thing that actually kids really like is some ginger tea with honey. You can make
Yeah, that's great.
ginger
Yep.
tea. That's pretty easy. You can just get ginger. I don't know if anybody, I mean, I love making natural tea. You can get like a teapot that has a filter in it or whatever. And you can cut up slices of ginger, add some boiling water, and you'll have your own homemade ginger tea. You don't need to be
Love
buying tea
that.
bags or anything like that.
And that's a fun
Um,
activity to do together. They feel like that could become the placebo. It's just doing the activity together.
Correct.
Yeah.
That's a great idea. Yeah, haven't done it with kids,
Like
but you're
whenever I was
absolutely right.
sick, mom would make tea with me, like, and everything was better. I
You're
love
right.
that.
And smelling the ginger,
That's
I mean,
great.
it's really just powerful. That in and of itself, probably turns on things in our brain. So yeah, so ginger tea can be really good when you're not feeling well. And this is the school age because we did talk about the 1 year, and I don't want the younger ones to burn. You would want a much cooler tea,
Right.
for a younger child.
Great. Here's a question from our audience. 5-year-old cries in pain about their legs at least once a week. She said the doctor mentioned it's probably because he's growing.
Yeah, that's probably true. I mean, I'm sure what the doctor did was check to make sure that nothing was broken, that they're able to run and play and things like that. Um, if it's something that, ramps up, that may be something that's worth another look. But if it's bilateral, meaning that it's happening in both legs, often we'll see these growing pains at night. You also may think, and this is where the integrative piece comes in, when is this happening? Is this
Mhm.
happening every time he goes to PE? Is it happening when a certain kid comes over the house? Is it
Uh,
happening when he has an exam at school? So
right.
integrative looks at not just where is your pain and where's your pain, but when does it happen? What
Yep.
else is going on?
Yeah.
So we want to look at the whole child, not just the area where we think about the pain, but what else is happening.
That's right. Oh, that's good. A good way to remember that. Every parent knows that your kid wants water and food and all the things right at bedtime, But that's good because you never know that the child might be telling you something because they feel uncomfortable with this kid who comes over to play or something like that. That's great. Good reminders to be asking those questions. I love that. I'm looking at our clock. We've got about 10 more minutes. So, audience, if you have a question, throw it in our question box. I do have several more I want to get through. I want to talk about immunizations, and then I also want to close this out with integrating natural and conventional medicine. So, but quickly, let's talk about immunizations. What is the role of immunizations in preventing serious childhood diseases? You talked on that at the front end, but hit us with it again.
Okay. There is no substitute for immunizations. Immunizations have saved millions and millions of lives on this planet. The childhood vaccinations, they're monitored, they're safe, they're effective. The diphtheria, tetanus, pertussis, polio, you know, when we stop immunizing, these diseases come back. You see this in countries around the world.
Yeah.
Luckily, we've been spared. Measles, in communities where people are choosing to not immunize against measles, they're getting measles back.
Wow.
Um, it's heartbreaking to read stories of somebody who's saying, if I had only known, well, it's out there. Unfortunately, it is, you know, I understand how difficult it is to be a parent,
Yeah.
to get the information that's out there. People will come to me and say, "Oh, but you're supposed to be integrative. I know you know that immunizations are bad." I'm like, "No,
Right.
that's actually not true."
Right.
Um,
And that's another question I have. I'm sorry to interrupt you, but maybe this is where you're going. But like how can parents balance the benefits of immunizations with their concerns about the potential side effects?
so the issue is what really are those side effects? I mean, and that's the first question. And who has validated those side effects?
Yeah.
Unfortunately, we live in a society where there are frankly people making money off people not wanting to get immunizations, people selling them certain vitamin concoctions. Oh, you can do this instead of that, or you can, and it's just not true.
Mm,
Okay.
yeah.
It's not true. What prevents measles is a measles vaccine.
Yeah.
That's it. Unfortunately, the kind of concerns that people had about, measles and autism, they're very scary.
Yeah.
But those studies have been done and done again. Unfortunately, the first person who put that out there, he's lost his license. The other people on
Oh,
the studies, have pulled their name from the study because they found out he was working with lawyers who were suing based on autism and measles. So
wow.
it's very scary where you're getting your information from.
Yeah.
The medical establishment is not, we don't make money off giving vaccines. In fact, it's quite the opposite. The amount of time we have to spend talking to people and we get maybe an administration cost, $10. So
Right.
um, we don't make money off vaccines. What we do get is a wonderful peace of mind knowing that children are protected from diseases. Now, there may be some kids where their doctors say no, a vaccine is not appropriate for you because of some underlying immune issue or something like that. And that's on an individual basis. But the vaccines are safe
Yeah.
and
Can you oh
people
sorry, go
should
ahead.
feel comfortable with that.
Yeah, thank you. Thank you.
But you
What
can
about
go, but the important thing is go to the CDC website. Okay.
yep.
Just because it's government doesn't mean they're lying to you.
Right.
Okay. I know we have a lot of fears about government for lots of, good and bad reasons,
Yeah, right.
but the CDC, great organization. The Academy of Pediatrics, healthychildren.org. You guys have that in your chat.
Yep.
Great organization. Read about the vaccines there and talk to your pediatrician about that.
Yeah.
Okay.
Great. Great. Okay, so risk and benefits of delaying or avoiding certain vaccinations,
Okay. So the challenge with
such
that
as
is,
vitamin K to newborns. Someone asked that, so I'm throwing
okay,
that in
vitamin K is essential. There's a disease called hemorrhagic disease in the newborn where our liver doesn't make those factors. Okay.
there. Mm,
Need that vitamin K shot to prevent against hemorrhagic disease in the newborn. We've seen a lot of parents trying to avoid that. It's very dangerous. Okay.
mm,
Now keep in mind that it's going to take a lot of kids before we see the problem, but there have been kids who have had problems with bleeding from not getting vitamin K. And that happens routinely in other countries where that vitamin K is not available.
yeah.
People say, "Oh, let me give it to him by mouth." The problem is that we don't know about what's called the oral availability of will the body absorb vitamin K. It's actually a hard vitamin to absorb. The only safe way to reliably get that, and that's to make the cofactors in the liver so that we don't bleed. Okay, so it's super important to get that vitamin K shot. That said, never seen a study that spoke about vitamin K shot being a problem. So
Yeah.
you want to, understand your doctor is not working against you. And we get all this information so have those conversations. But this is called hemorrhagic disease in the newborn, and anybody can look that up. But it's a very difficult problem that I assume there's some TikTok going on about it. But
Who knows?
it's hard because like I said, it's really hard as a parent to
Yeah.
sift through that information. But that's where
Yeah.
your pediatrician is a great resource.
Yeah, that's great. They're the professionals and the experts for a reason. Okay, let's see. I'm watching our time. We got about 6 minutes, so I'm gonna rapid fire through some of these. But how can parents effectively integrate natural and conventional medicine into their child's healthcare routine? And we've talked about integrate that,
Right.
asking those right questions and stuff. So in our normal routine, like leave us with something that we can, interact in our new routines.
Sure. Natural medicine is nutrition.
That's great.
So focusing on healthy foods, if you're in an apartment, grow basil in front of a window.
Yeah.
Okay. Work with spices, work with cooking. Cooking with the family is what will keep you healthy. There's a great, I think I put in the chat, chopmagazine.org, that gives healthy recipes that you can do with kids. But really growing a garden, whether it's, on a tabletop or in a yard, um, great things. Chewing those basil leaves is great. Chewing arugula, great.
Love it.
When you model that behavior for kids, that's integrating natural medicine. There's no
Yeah.
more powerful natural medicine than working with food and working with healthy food. Honey, obviously one of my favorite things for the, kids over the age of 1, best natural medicine that there is. Sleep. Sleep is super good. Incorporating sleep into that natural routine.
Mhm.
Getting kids off screens, getting them outside, playing
Yes.
in the dirt. Do not be afraid of dirt. Dirt is a natural medicine, okay?
Dirt
As
don't
long as
hurt.
I
That's what my mom used to say. Dirt don't hurt.
Right, exactly, exactly. Dirt is good for you. There have been great studies on that, dirt really does help, assuming it's not a place that was a chemical disposal plant,
Yeah.
area.
Hopefully, we're not playing there. A few questions from our audience. When there's a cough or something similar to the flu, why do they tell you to remove dairy products?
Yeah, that's kind of a little bit of an old wives' tale. I mean, some
Okay.
kids, but what I tell people
If it works for you,
exactly
right?
what we said, if it works
Yeah.
for you, that's great. Some kids respond to not using dairy. Now, with diarrhea, if you remove dairy, that can be positive. And the reason for that is when we have chronic diarrhea, when we've had diarrhea for a couple of days, we lose what's called a border of our GI tract that helps break down the particular sugar that's in milk. So sometimes taking milk out of the diet for a week or two can help heal the gut because that may promote more diarrhea. So in that case, taking milk out of the diet is good. In terms of colds and flu, each person is individual. So I would never say to somebody that if you're telling me that when you give your kid milk when he's sick, he coughs more, then don't give it. There's absolutely no reason to give milk in general. I mean, there's plenty of healthy vegan kids. So if you don't want
Right.
to give it at a certain time, that's fine.
Okay. On that note about the milk, one of our audience members said, "What is the recommended amount of milk per day for a 2-year-old?"
Yeah. So I think, work with your pediatrician on your individual child, but generally I'm not a big milk person. Everybody has their own bias, but if they get, first of all, they don't need milk at all. Okay. So there is no need for milk. Unless you're a baby cow. So there,
Yeah.
there is no need for milk. There's other ways to get the calcium nutrients and things like that. And as I said, there's many kids who are vegan. There are kids that have milk protein allergies. So I don't want people to think they absolutely need to give milk. So within that framework, I would say, if they get, 8 to 10 ounces a day, that's fine.
Okay, great. All right, here's another one. Honey with ginger and onions. Is it good to have those ready in the fridge to help prevent a cold?
Uh, Sure. I mean, onions actually have a lot of you know, natural benefits. I don't know the kids are sitting down to a bowl of onions,
Yeah.
but you
Take a
know,
bite.
but yeah, so onions are fine.
Sneak them in when you're cooking, right?
Yeah, none of this is necessarily going to cure. It may be helping them support, but there is no magic out there. The magic is what you're doing every day with the healthy foods.
That's great. All right, what about does cornstarch help with rashes?
Not a clue. I mean, I never used it.
Yeah,
For rashes, so in terms of general natural skincare, that's a whole other conversation. I
right.
like to use a lot of coconut oil on skin. First of
Yeah,
all, I don't like to use a lot of anything on skin if it doesn't need it.
right.
Nobody needs a lot of soap. Babies don't need to be scrubbed or anything like that.
Yeah,
If it smells, generally don't use it.
right.
Fragrances aren't great for kids. Um, I would say the only concern I would have about cornstarch is if they were breathing it in into their lungs. But in turn, talk with your doctor about that. But I would say in general, I like to use a lot of natural coconut oil on the skin, or sometimes I'll use sunflower oil on the skin. Sometimes there have been some studies that shows that helps with some eczema. I love using natural shea butter. Shea butter is great.
Okay.
Sometimes, I'll recommend people put it in the sun and mix a little coconut oil in it. So it makes it easier to use when kids have rashes and things like that. We probably overbathe our kids. That's probably the bigger problem that we have, where we break down, the natural barriers of natural oils.
Yeah, it's great. All right, two last things. So this is more just and speaking to your point of, if it works for you, that's awesome. So one mom says that she started to give her 4-year-old a pediatric iron supplement after reading a study about restless leg, ferritin levels, and poor sleep. And she said it's done wonders for them. She went from waking 3 times a night to sleeping every night soundly. So there you have it. There's something that's working.
Yeah,
Um,
ferritin can be very useful for kids with ADHD and things like that. Not ferritin, the iron. But if you do have a concern about your kids' ferritin levels, that's something that can be checked.
Yeah, that's great. Okay, this listener, I'm watching our time. I'm gonna have to wrap us up soon. But so the one listener has a question about how can she help make the best breast milk possible. I want to put a plug. We have a whole episode on breastfeeding, all things about nutrition, breastfeeding. I don't want to steal your thunder, Dr. Worm, but I want to say that healthy nutrition is the best thing you can do, right? So tell us.
You got it. So healthy nutrition, take your prenatal vitamins, lots of liquid.
Awesome. Drink all that water. This is great. Okay, last thing to kind of tie a bow on our time. How can parents find qualified healthcare providers who specialize in integrative pediatric medicine?
Yeah. So like I said, I mean, you know, there aren't many of us who are board certified in integrative medicine. So, I'm not even sure if there's anybody else who's taken those boards or fellowship down here.
And
I
that's a
don't know.
big deal for those of you listening to be board certified in this. I just don't want us to gloss over that, but that's a big deal to be board certified in
Well,
this.
but I would say any doctor that's going to spend the time with you is the right doctor. Certainly at University of Miami, our pediatric practice, we do have doctors that really do try and spend time with patients, not write, prescriptions very quickly or anything like that. So, at our office at University of Miami Pediatrics, we certainly do spend time with our patients and try and work towards that.
That's great. Dr. Worm, thank you so much for your time today. I want to draw your attention, those of you listening. We've got a slide here. You could screenshot this if you want or snap a picture with your phone. These would be great ways to continue your education on what we've talked about today. For those of you who had the questions about breastfeeding, there are 2 episodes about breastfeeding and the recordings, as well as, again, dozens of others. There's a great nutrition episode there if you want to dig into what Dr. Worm has been talking about today. So important, our nutrition. There's a whole episode dedicated to that at parentalguidance.org. So check that out. You can screenshot this. I also want to tell you, mark your calendars to join us next month on Thursday, October 17th, again at noon. We're the third Thursday of the month at noon. It's let's talk about bones and muscles. So we're going to join experts to get insights into your child's orthopedic health. So discover essential information about your child's bone and muscle health, something maybe we don't think about until it's a problem, but a lot that we can be doing to be proactive. So we're going to learn about scoliosis, new treatments, signs of fractures. How do you know if your kid has fractured their foot? What about common issues like flat feet or growing pains? Someone asked the question today about their legs are hurting. What do we do? What about bow-legged or knocked knee conditions? So we're going to get insights on preventing sports injuries, managing development of hips dysplasia, preventing strains, all these things. So find out when we seek specialist care and how physical therapy can support orthopedic health. So don't miss this episode about keeping your child's bones and muscles in tip-top shape. Again, that is going to be Thursday, October 17th at noon. So mark your calendars to join us again. Dr. Worm, thank you so much for your time and expertise today. It was a delight to get to chat with you. We learned so much.